Welcome back to this special edition of ABC4 News. We're joined by Dr. Angela Dunn to answer your questions about COVID-19. So it's been a pretty big year for you. You've come into Salt Lake County. You've become the executive director for Salt Lake County Health. I want to first talk about Gary Edwards.
Yeah.
I believe we are in a good position.
What kind of lasting legacy did he leave? Any good tidbits that he gave you before he actually left?
I think the best thing he gave me was a wonderful organization. I mean, people who work here love working at the health department. They're passionate, they're committed, and that's all due in part to Gary's leadership. His saying was, we want to be the best at getting better, and I couldn't agree more. Improvement is the way we need to look at ourselves and be willing to change and get better. He's a great guy. Thank you. Thank you to the state of Utah, to my Utah Department of Health family, of course, the media, and all the Utahns out there who have been such a great support over the past 14 months.
Well, let's talk about the transition, because you moved from the state to, local government. What's that been like for you?
Gosh, it's been so much fun. Just with the COVID response specifically, it's such a smaller ship to steer and turn around, and it's amazing how quickly we can react to situations and respond so effectively and efficiently, because everyone's here and can get to the table quickly, and there's less bureaucracy to go through. So it's been really fun to see that kind of almost direct impact on the community.
Lessons learned. We talked about it at the beginning of this.
Oh,
What's
sure.
some of the lessons you learned going from the state to here?
That politics are pretty much the same no matter where you go. That's a steep learning curve that I learned in COVID. And I've learned a lot there, how politics and public health are impacted, and they impact each other. And that's not necessarily a bad thing. I mean, I think democracy is great, and we should encourage that. But, bringing together stakeholders from a variety of areas is really important when we're addressing something like a pandemic. And it doesn't matter if you're on the state level or the local level. You still have to consider all those different voices.
Well, we have some breaking news. We're still in the pandemic right now.
Darn it.
And part of it was like at the very beginning of the pandemic when we were talking with you, kids were not the focal point. They weren't the subject of everything. So why are kids the subject now?
Because now there are only ones that are vulnerable. We were really lucky in this pandemic that our kids weren't impacted as greatly as our elderly. Now, our elderly are vaccinated. We don't have outbreaks in long-term care facilities. We don't have, double-digit deaths every day, and that's fantastic. But now our focus can be on those under 12, and yes, they're still hospitalized, and unfortunately we have had an individual die in this county that was young. And so now's the time we can turn our attention to protecting them.
Well, the CDC recommends kids wear masks in school. The governor plans on handing out high-grade masks.
Parents and students will have the opportunity to have available at no cost to them a KN95 mask.
How do you think the health department can help navigate this whole situation with the area's school districts?
I've been working with our superintendents, our private and charter schools, county council, board of health, mayor's office, everybody to try to understand the best way forward for our community. Because yes, I could mandate something, and yes, the county council can overturn it the next day. However, no mandate's gonna work unless we have public buy-in. So it's really important to make sure everybody understands the science, the gravity, and then we'll work together to figure out the best path forward.
Let's wrap this up a little bit. What's 4 tangible things that we can share with our viewers?
I mean, first, of course, if you're eligible, get vaccinated. We know the vaccines are safe and effective. And if you have concerns, reach out to your healthcare provider. Have that one-on-one conversation, but really seek out all the information so that you can make the best decision for yourself, and hopefully that's vaccination. The second is, if you're not eligible for vaccination or you choose not to get it, you need to still be wearing a mask in public. You need to be avoiding crowded indoor public settings where COVID is spreading. That is super important. I will say the third thing that's really important is to not give up. Yes, we have a great vaccine. However, 20% of the county is not eligible for vaccination yet. We are about to start the school year with a higher case rate than we did last year. So unfortunately, we're not at the end of this, so I'm asking for resilience and persistence in our community to keep fighting. And then the fourth thing is respect for each other. We of course have different opinions, and that's what's wonderful about our country, our state, our county. But the personal attacks, the disrespect we're showing each other over COVID is gonna only fuel the fire more and lead to more divisiveness when we should be coming together, especially for our kids starting back at school in a week or two.
Thank you, Dr. Dunn, for sharing your perspective with our viewers. And if you would like any of this information, all you have to do is head to our website, abc4.com. I'm Jason Wynn. Thank you for joining us.